Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let's begin with a simple instruction. Do not think of neck pain as only a neck issue. Look wider. Ask, why does the neck hurt in the first place? How does a small region between the skull, shoulders, jaw, and upper back become such a loud alarm system? For many people, neck discomfort begins with mechanical load, long sitting, forward head posture, clenched jaw, shallow breathing, stress, poor sleep, heavy phone use, and repetitive shoulder elevation. But here is the part many people miss. Muscles do not tighten in isolation. They tighten through chemistry, electricity, circulation, nerve sensitivity, and energy demand. The neck is not just bones and muscles, it is a living electrical network. So today, focus on magnesium not as a magic pill, but as a biological regulator. Treat it as a mineral that helps the body manage nerve excitability, muscle contraction, energy production, and pain amplification. Why does that matter? Because neck pain often lives in the space between muscle tension and nervous system sensitivity. Medical references describe magnesium as essential for neuromuscular transmission, muscle contraction, cardiac excitability, glucose metabolism, and energy-related reactions. The NIH Office of Dietary Supplements also notes that inadequate magnesium can progress into numbness, tingling, muscle contractions, and cramps, and that many people consume less magnesium than recommended from food and beverages. Now ask the key question: how can magnesium help a painful neck? It may help through 4 connected pathways: relaxing overactive muscle signaling, supporting cellular energy, reducing pain sensitization, and improving the conditions under which recovery happens. But listen carefully. Do not use magnesium as an excuse to ignore posture, movement, strength, or medical warning signs. Use it as one tool inside a broader recovery strategy. Neck pain care still needs motion, load management, ergonomic correction, breathing, sleep, and, when needed, professional assessment. Clinical guidance for non-specific neck pain continues to emphasize self-management and exercise therapy, especially when symptoms last beyond the early stage. First, understand the muscle story. Place your hand gently on the upper trapezius, the muscle running from the neck to the shoulder. Now shrug slightly. Feel that? That muscle works all day. It holds the head, responds to stress, stabilizes the shoulder blade, and reacts when you sit with the chin drifting forward. Ask yourself, why would this muscle become irritated? How could it not? The average adult head is heavy, and when it shifts forward, the neck and upper back muscles must work harder. Over time, the tissues may become guarded, tender, and less tolerant of load. In clinical pain language, this can involve myofascial sensitivity, trigger point-like tenderness, and altered neuromuscular control. Magnesium enters this picture because muscle contraction depends heavily on the balance between calcium and magnesium. Calcium helps muscles contract, magnesium helps regulate that process and helps the muscle return toward relaxation. Think of calcium as the signal that says, contract. Think of magnesium as part of the system that says, control the contraction. Do not overfire. That is not poetry. It is physiology. Magnesium participates in neuromuscular transmission and the calcium transport systems involved in contraction and relaxation. A 2024 systematic review in the Journal of Translational Medicine summarized magnesium's role in neuronal activity, vasomotor activity, neuromuscular transmission, muscle contraction, and muscle soreness after activity. Now ask, how does that translate into neck pain? If the neck muscles are overworked, under-recovered, or chemically under-supported, they may stay in a more irritable state. Magnesium may help restore better muscle behavior, especially in people whose intake is low, who sweat heavily, who train intensely, who drink a lot of alcohol, who have gastrointestinal issues, who use certain diuretics or proton pump inhibitors, or who are older. These groups are more likely to have magnesium inadequacy or magnesium loss. Do this practically. Review the person, not just the pain. Ask, does the neck pain come with cramps elsewhere? Eyelid twitching? Poor sleep? Stress overload? Headaches? Heavy sweating? Low dietary intake? Digestive problems? Medication use? These details matter because they change the likelihood that magnesium will be useful. Second, understand the pain sensitivity story. Pain is not only a signal from tissue damage. Pain can become amplified by the nervous system. This is called sensitization. When the spinal cord and brain become more reactive, ordinary muscle tension can feel more intense. Why does this matter for the neck? Because chronic neck pain often becomes more than a tight muscle. It becomes a trained alarm. Magnesium has an important relationship with the NMDA receptor, one of the receptors involved in pain amplification. A review in Nutrients explains that magnesium can block NMDA receptor activity and reduce calcium entry into cells, a mechanism linked with limiting central sensitization and pain hypersensitivity. Say that in plain language. Magnesium may help turn down part of the volume knob on the pain system. It does not silence the whole alarm. It does not repair a disc, erase arthritis, or replace physical therapy. But it may make the nervous system less reactive, and that can make movement, stretching, strengthening, and sleep easier. Ask, how do we make a painful neck recover? Do not only chase pain, improve the environment in which healing happens, reduce threat, improve sleep, support mineral status, move gradually, strengthen the shoulder blades, breathe through the ribs, relax the jaw, change the screen height. These are not separate ideas. They are one recovery system. Third, understand the headache connection. Many people with neck pain also describe headaches. Pain at the base of the skull, pressure behind the eyes, temple discomfort, or migraine-like episodes. Why mention this? Because the neck and head share nerve pathways. Irritated cervical muscles can feed into head pain patterns, and headache disorders can create neck guarding. Magnesium has more established evidence in migraine prevention than it does in direct treatment of non-specific neck pain. The NIH notes that magnesium therapy has been judged probably effective for migraine prevention by neurology headache guidelines, although higher migraine prevention doses should be supervised by a healthcare provider. NCBI's review chapter on magnesium and headache describes trials where oral magnesium reduced migraine frequency or severity in some adult studies, while other studies were negative or limited by tolerability and absorption issues. It also points out something many people never hear. Routine serum magnesium can look normal even when intracellular or ionized magnesium status may not fully reflect body stores. Now ask, how is this useful for neck pain? If a person's neck tightness is tied to migraine biology, stress reactivity, or recurrent headaches, magnesium may help indirectly by reducing the headache tendency that keeps the neck muscles protective and tense. Treat the loop. Headache increases neck tension increases headache, poor sleep worsens both. Magnesium may help interrupt part of that loop in the right person. Fourth, understand recovery after load. Some neck pain appears after training, lifting, long driving, desk marathons, or sleeping in a strange position. In those situations, muscle soreness and recovery capacity matter. The 2024 Systematic Review on Magnesium Supplementation and Muscle Soreness found that magnesium supplementation in physically active individuals was associated with reduced muscle soreness, improved recovery, and a protective effect on muscle damage in the small group of eligible studies reviewed. But be precise. Do not exaggerate. Evidence for magnesium in general skeletal muscle cramps is mixed. A Cochrane review found that magnesium is unlikely to provide meaningful benefit for idiopathic skeletal muscle cramps in older adults, and evidence for exercise-associated cramps or disease-related cramps remains limited. So what should you do with that? Be honest. Magnesium is not a guaranteed cramp cure. It is more likely to help when there is low intake, high loss, muscular overuse, headache overlap, stress physiology, sleep disruption, or signs of neuromuscular irritability. Ask, who is the person in front of us? What pattern is the body showing? Now move to action. First, build magnesium from food. Command the plate before you command the supplement bottle. Add pumpkin seeds, almonds, cashews, black beans, spinach, edamame, whole grains, dark chocolate in modest amounts, and mineral-rich foods. The NIH identifies green leafy vegetables, legumes, nuts, seeds, and whole grains as good magnesium sources. Second, if supplementation is appropriate, start low. Consider 100 to 200 milligrams of elemental magnesium in the evening, especially if the person has tension, sleep disruption, or exercise-related soreness. Choose forms that are generally better tolerated, such as magnesium glycinate or citrate, while remembering that citrate may loosen stools. Do not assume more means better. Third, respect safety. The adult tolerable upper intake level for supplemental magnesium is 350 milligrams per day, not counting magnesium naturally present in food. High doses from supplements or medications can cause diarrhea, nausea, abdominal cramping, and, in extreme cases, toxicity. The risk is higher with impaired kidney function. Magnesium can also interfere with certain medications, including some antibiotics and bisphosphonates, so spacing and medical guidance matter. Fourth, combine magnesium with mechanical correction. Do this today. Raise the screen to eye level. Pull the shoulder blades gently back and down. Keep the jaw unclenched. Every 30 to 45 minutes, stand up, turn the head slowly right and left, breathe into the lower ribs and reset the shoulders. Strengthen the deep neck flexors and scapular stabilizers. Stretch lightly, not aggressively. Why? Because a mineral can support the physiology, but movement teaches the tissue how to behave again. Fifth, know the red flags. If neck pain follows trauma, comes with fever, unexplained weight loss, cancer history, progressive weakness, numbness down the arm, loss of coordination, severe new headache, dizziness with neurological symptoms, or bowel or bladder changes, stop self-treating and seek medical evaluation. Do not let a supplement delay diagnosis. So, why can magnesium be beneficial for neck pain? Because neck pain is often not just a local ache. It is a conversation between muscle tone, nerve excitability, energy metabolism, sleep, stress, and pain sensitivity. Magnesium participates in that conversation. How can it be effective? Use it intelligently. Correct low intake. Support muscle relaxation. Calm overactive signaling. Help recovery after load. Consider it especially when neck tension travels with headaches, cramps, twitching, poor sleep, stress load, or heavy physical demand. But keep the final message clean. Magnesium is not the whole treatment. It is a well-placed lever. Pull it alongside movement, posture correction, strength, hydration, sleep, and professional care when needed. Do not chase comfort only. Rebuild capacity. Take this with you. When the neck tightens, ask better questions. Why is the muscle guarding? How is the nervous system reacting? What is missing from recovery? What can we change today? Start there, and the solution becomes more precise. Thank you for being here with me. Take care of your body, take care of each other, and I'll see you with our next topic in the next episode. Like always, we keep learning as one family.